Bloodstream infections, or sepsis, can be difficult to diagnose and treat, and antibiotics appear to be becoming less reliable in managing some of them. The University of Michigan Health System is utilizing a multidisciplinary approach to learn better ways to diagnose and treat sepsis.
Bloodstream infections are infections that typically begin in a local part of the body, say in the bladder or the skin or the lung, and then the bacteria that cause those infections manage to sort of break free from the usual defenses and make it into the bloodstream, and that gives the bacteria an opportunity to go essentially anywhere it wants. Once it's in the bloodstream, it can travel to distant organs, it can travel to the brain, it can travel to the heart, and it's basically sort of a horse out of the barn. Bloodstream infections are a problem because most of the defenses that your body has built to fight infections are defenses that were built against things like splinters and wound infections and sore throats and bladder infections, things like that. They're defenses that were built to go somewhere to do a thing. They're a local defense. And the problem with bloodstream infections is that when a bacteria is allowed to go anywhere, it has the opportunity to rewrite the rules. And now defenses that were local and designed to be local are suddenly being deployed everywhere. The standard treatment for bacterial infections in the bloodstream or elsewhere are antibiotics. And what's clear from the last 50 years, and antibiotics have only really been around for about 50 years, is that they're becoming less and less reliable for taking care of infections. And so what we're looking for are ways of treating the disease and helping along the host defense in such a way that doesn't require antibiotics. And one of the ways that we're looking to do that is we're looking to find a strategy to improve the ability of the bloodstream to filter these things out. How can you get them out of the bloodstream even faster? Are there mechanical tricks that you can play on the bacterium that don't require antibiotics that will allow the body to grab it, pull it out of the bloodstream, and resolve the infection faster? One of the things we're trying to understand are the rules for how bacteria traffic in the bloodstream, and if you understand the timing of those events, you might be able to better understand how best to detect the bloodstream infection when it's present. That's the first issue. The second thing that we're working on are looking for ways to just fundamentally change the rules of engagement between the bacteria and the host. There are mechanical features at play in terms of getting these bacteria in flowing blood out. If we can change the mechanics of that event, then we can potentially have a therapy that the bacteria doesn't really have an opportunity to defend against, that it doesn't have the ability to develop resistance against, and potentially could be a useful therapy.